Meanwhile, there are calls tonight for a thorough investigation into that fire at Maxeke Academic Hospital. The blaze destroyed personal protective equipment and hundreds of patients have been evacuated due to concerns about the safety of the facility. The hospital is also home to the National Health Laboratory Services Lab, which handles tests for HIV, cancer and COVID-19. Bahule Mutlonyane is with the National Health Laboratory Services and joins us now live to talk more about this. Bahule, thank you so much for your time tonight. How have the National Health Laboratory Services been affected by the fire at Maxeke?
Thank you, sir. What's happening here is that with the closure, we have had the main areas which were affected was last night, because as you are aware, the blaze continued through the night. All the samples which were received yesterday, we had to relocate them from last night even through this morning, and those samples have been in process as we speak now. So possibly that will be the main thing which will have affected us. From that, the other issue is that the issue of the temporary closure, we will note that where all these patients have been transferred or relocated to, we have NHLS laboratory available in those sites. So the testing will continue as normal, and those patients will continue to get those services, or the department will continue to get those services in those areas.
So some of the treatments that people require that they need these tests done for often need quite speedy resolution. Do you expect the move that you've now had to do with the moving of some of these samples to other facilities, will that affect the return time?
Yeah, for yesterday's sample, I must agree that there will be a slight delay, because we tried to move those urgent ones of last night, but there's a combination also of samples which I think which will be delayed for this particular incident, because we couldn't move all of them last night. We moved some, and some of them have been moved this morning. So, but I will accept that because it's weekend, we could be able to finish some of them by end of possibly tonight or tomorrow morning. Then some of these results will be back with where they're supposed to be. The main area will be that wherever those patients are transferred, if the clinicians are aware, they can be able to access those results on our web view portal for results. So they can still be able to access those results if they require to follow up on those results on the samples which they've sent.
Do you have numbers at this stage?
In particular, those patients who've been deployed to the hospitals.
All right. My apologies for jumping in there. Do you have numbers tonight of what's already been processed and what you're still waiting for from these samples?
I don't have the numbers right now. The only thing I can share with you was that this afternoon, no, not this afternoon, by 2 o'clock when I was following up with the team, there were only about 400 samples which were about to be moved from Maxeke to one of our testing sites. Either it could have been Helen Joseph or Chresani Baragwanath. But majority of them have already been moved, because in a day, normally we get samples ranging between about 8,000 to 10,000 samples on a day. So you can notice that majority of them have been moved already. 8,000
to 10,000 samples a day. That's quite a large number. Final question, have any samples then in the fire yesterday either been damaged or lost?
None, nothing has been affected. As you will be aware, the lab was not also affected by the main issue was, the smoke and all that. That's why we had to shut down, and the risk which was posing for staff and all that. So nothing of our staff or samples have been affected. All the samples which we have received will be processed.
Bola, thank you so much for speaking to us tonight from the National Health Laboratory Services. They're taking stock of the impact of the fire at Maxeke Hospital on their services. Thank you.